Hello, everyone. This is Molly, and today I'm going to talk to you about a new partnership that we have with the Cleveland Department of Public Health. The Cleveland Department of Public Health currently operates a 24-hour hotline for reporting outbreaks, biological agents, and Class A infectious diseases. 211 will begin handling these calls on February 11th, 2020, so on 211 day. The hotline handles approximately 300 calls per year, so less than one per day. And most callers are actually reaching out to this number because they believe that they can get help with other issues. The hotline operators have been referring a majority of their callers either to other divisions within the Cleveland Department of Public Health or to outside agencies. Often, people are calling the Cleveland Department of Public Health infectious disease hotline with questions about programs and services that we already have in Refer. Common questions include questions about air quality, animals and pests, birth and death records, building and housing issues, flooding and sewage, restaurants and food service, or vaccine information and immunizations. Calls for the Cleveland Department of Public Health Infectious Disease Hotline will be presented through In Contact on a skill called CDPH. You will greet the caller by saying, Cleveland Department of Public Health Emergency Phone, are you calling to report a disease or other public health emergency? And then you will open up a transaction in the CDPH access site in Refer. It's recommended to use the category search for CDPH calls. The resource team built this out to allow you to be able to quickly navigate to the most common topics that people call about. You will search for and record referrals in the same way you would if it were a 211 caller asking for this information. If the caller is asking about something that is not in the category search, you can use the taxonomy search for locating other services. So I'm going to stop here in the PowerPoint, and I'm going to pull up Refer and demonstrate what I've talked about so far. So first thing, the call is presented on the CDPH skill. You're going to go ahead and start a new contact. You are going to select the CDPH access site. You can enter in the caller's demographics, and I'm just going to enter in, I'm just going to put in 44114, and we'll say this is a 30-year-old female in Cleveland. And then I'm going to hop on over to the category search, and you'll see here it says Health Department frequent caller topics. And then when I click on the plus sign here to expand it, I see those commonly requested topics that I mentioned before: air quality, animals and pests, birth and death records, building and housing, disease outbreak and biological agent reporting, flooding, sewage, and pool sanitation, restaurants and food service, and vaccine information and immunizations. And then I can just click on the little plus sign. It'll expand, and you'll see the associated taxonomy terms that would fall under these broader categories. And then you would just use these terms and search as you normally would in Refer. Go back here to our PowerPoint. Okay. There are going to be 2 additional contact data questions that you will need to record. The caller name, if provided, and if the call is standard navigation or a transfer to the Cleveland Department of Public Health. If someone is calling to report an outbreak, biological agent, or a Class A disease, you can use the category search and select disease outbreak and bioagent reporting, then communicable disease control. Or you can do a taxonomy search using communicable disease control. You will get a pop-up stating that if a medical professional or other individual reaches the Cleveland Department of Public Health skill to report an outbreak, biological agent, or any Class A disease, or to conduct an emergency test, follow the instructions in the unpublished section. I'm going to pause here and go back to Refer and show you here that if I select disease outbreak and biological agent reporting, and then select communicable disease control and do my search, I will see the City of Cleveland Department of Public Health, and you'll see the pop-up coming up directing me to follow instructions in the unpublished section. If it's someone wanting to make a report, I'm going to select See Detail. And then you'll see here, I'm going to scroll past the unpublished for just a moment. And highlight here the service description of what they do there. That's what I'm going to talk about next in the PowerPoint. Okay. The Cleveland Department of Public Health Office of Communicable Disease Surveillance and Epidemiology Unit provides information leading to actions that prevent and control usually infectious but possibly epidemic diseases. Services include collecting data on how often and where diseases are located in the community, providing health education on disease characteristics and prevention, and what to do in cases of outbreaks, particularly about issues such as pandemic flu. In most cases, callers wanting to make a report will be medical professionals. If the caller says that they need to report an infectious disease, you will need to verify if it is a Class A disease. You'll find a complete list of Class A diseases in the unpublished section. And you will also find a complete list of Class A diseases on the data page in the contact marker section. So I want to show you guys that here in Refer. All right, so here in the unpublished section, you'll see in the second part of that, it lists all of those Class A diseases. And then if I go to the data page, in the contact marker section, Class A diseases, it's the very bottom one. If I click on there, a document opens up that lists Class A diseases in alphabetical order. If somebody is calling to report a disease and it is not on this list of Class A diseases, there will be a different way for us to handle those. So we'll talk about that momentarily. And then I also wanted to point out, because I failed to do so before, the additional contact data questions. You'll see it right on top of the contact data section. And you'll see if I click here where it says client name, if willing to provide, enter name here. If I click on there, then a text box opens up and I can enter the person's name. If they don't want to provide their name, you will just select client decline to provide name. And then activity type here, it's either standard resource navigation and referral or transfer to health department. So depending on if we are just providing them with information or if we are transferring that person to the on-call staff person at CDPH. All right, let's hop back into the PowerPoint. Okay. If the caller is reporting something other than an outbreak, biological agent, or Class A disease, or if they are looking for information about disease prevention and control, then you will provide them with the non-emergency line that is listed in Refer. So that's 216-664-3747. And that non-emergency line is available Monday through Friday from 8 a.m. until 5 p.m. If the caller is reporting an outbreak, biological agent, or a Class A disease, you are going to save a referral to the Office of Communicable Disease Surveillance and Epidemiology Unit and record the call as a Level 3 advocacy/warm transfer. And then you're going to warm transfer that caller to the CDPH on-call staff person. If the caller is reporting something other than an outbreak, biological agent, or Class A disease, or if they are looking for information about disease prevention and control, you will save a referral to the Office of Communicable Disease Surveillance and Epidemiology Unit and record the call as a Level 2 assess and refer, and then you will provide them with that non-emergency number that is in Refer. The Cleveland Department of Public Health staff person on call is going to rotate. The person that we'll be reaching will rotate throughout the year. Joe is going to be creating a CDPH address book in Contact and updating it each time that the on-call person changes. When you need to transfer a caller wanting to report an outbreak, biological agent, or a Class A infectious disease, you will first try to warm transfer to the CDPH primary number. What I would suggest in Contact is just searching by typing in CDPH, and then both the primary and the secondary number will come up. If you get a voicemail or if no one answers at that primary number, then that's when you're going to try the secondary number. And again, you need to make sure that a live person answers before you complete the transfer. So if you try the primary number without success and you try the secondary number without success, in that circumstance, then you will need to call the supervisor line. Twice a year, this hotline receives a test call, and this test call is to ensure that the CDPH staff are responding quickly to reports of outbreaks, biological agents, and Class A diseases. And internally, CDPH refers to these test calls as $11,000 calls. Because if they do not respond to a test call, one of those test calls within 1 hour, then they stand to lose $11,000 in funding from the state of Ohio. So I can't stress this enough. These are extremely important phone calls. It's imperative that if you receive one of these test calls, that you complete a transfer to the CDPH staff person on call quickly and properly. These test calls should be recorded in refer the same way as if the caller were actually reporting an outbreak, a biological agent, or a Class A disease. And the caller will tell you that it's a test call, so you'll know right up front that this is one of those $11,000 calls. This is not a secret shopper call. Thanks, everybody, for your time and attention. And if you have any questions regarding this partnership or policies or procedures regarding this program, please send an email to 211-SUPERVISOR and then CC me on that email as well, mblack@unitedwaycleveland.org. Thanks, everyone.